Hello everyone, this is Dr. Raghuram, consultant orthopedic surgeon, Pace Hospitals, Hyderabad. Today I am going to discuss about knee arthroscopy, that is keyhole surgery in the knee joint, and other topics regarding those. The knee arthroscopy is actually a keyhole surgery where we don't open or cut the knee properly to see the bones or ligaments inside. We keep a camera inside from one side of the knee and we introduce the instruments from the other side so that we can do the procedures inside the knee joint. So it will take around half of an inch of a wound for that to happen. So how long does the knee arthroscopy take? It takes around 1 hour. It also depends on the procedure which we are doing. If I am going for an ACL reconstruction, which is commonly performed, it will take around half an hour to 45 minutes. If I am also dealing with cartilage injuries or if I am dealing with some meniscal injuries, it may take around half an hour longer. But definitely any procedure per se in the knee arthroscopy will definitely finish within half an hour to 1.5 hours, not more than that. Knee arthroscopy is performed with the patient in anesthesia, lying down. There are an instrument cluster with us, which includes a camera which will be introduced in the knee joint, which is around half an inch of a diameter, and the instruments are also small, which we introduce inside the knee joint and do the surgery. The most common surgeries performed in the knee arthroscopy are ligament injuries, cartilage injuries, meniscal injuries. We can treat multiple types of conditions by knee arthroscopy, including ligament problems, meniscal problems, cartilage problems like cartilage wear and tear, ligament problems like ACL ligament, that is anterior cruciate ligaments, which control the stability of the knee, posterior cruciate ligament, and the meniscal injuries, which usually happen during sports injuries like basketball, volleyball or football injuries, can be treated by knee arthroscopy. Knee arthroscopy will also be helpful in treating cartilage injuries, that is the wear and tear of the cartilage in middle age and the older age people, which doesn't need a total knee replacement in most of the situations. So there are so many diagnostic tests which are there in the market to find out whether there is any problem and whether the patient needs a knee arthroscopy. But before going to the diagnostic test, I just want to introduce few anatomical facts in the knee joint. This is your thigh bone and this is your leg bone. So these two bones act in one way. It is a two-dimensional movement which is happening, but this movement is being controlled by ligaments on all sides. This side, the other side, even the front and back. Any of these ligaments, for example, this is a ligament which is connecting the two bones. So any of these ligaments on all the sides, if it undergoes any of the damage, then the knee will be very unstable, creating an extra movement when you walk, when you jump, or when you do some sports activity. So the common reason for this ligament injuries could be a twisted injury, whether you fall from a bike, when you have an injury while playing football, when you have injury when you slip and fall at your home. So whenever there is a twisting force in the knee joint, the ligaments tear. They may tear completely or partially. So to confirm, we usually do some clinical test. We hold your knee joint and test whether there is the ligamentous laxity or ligament instability, which I can find out myself when I am examining you. To confirm the diagnosis, to confirm that there is a ligamentous injury, definitely I have to ask for an MRI scan. Usually the x-rays which we take regularly doesn't show any ligaments. In x-rays only bones are visible. So if I want to get an idea about your ligaments, meniscus and cartilage, definitely the patient has to undergo a knee MRI. See, traditional surgeries which were done in the knee joint around 20 years ago in India were actually cutting up the entire knee joint, opening it and fixing. Knee arthroscopy is completely devoid of cutting the bones or skin. So we are doing it in a camera basis with a half-inch wound. So the benefits are less damage to the tissues around the knee joint, less problems with the wound, early wound healing. Since the muscles around the knee joint are stable and undisturbed, recovery of the patient happens very quickly. So the benefits are less blood loss, early recovery, easy surgery, less time for the surgery. See, the success rate of knee arthroscopy is very good when compared to the traditional surgeries, that is opening the entire knee joint. But definitely the success of the knee arthroscopy purely depends on the post-operative physiotherapy, that is the exercise which will be done after the surgery. So most of the knee arthroscopy cases include the stabilization of the ligaments which were torn. So after the stabilization of the ligament in the surgery, the muscles around the knee joint should be trained properly so that the success rate of the knee arthroscopy will be very good. So definitely the surgery is part of it, but the part of the success in the knee arthroscopy also depends on the physiotherapy, that is the exercise training in the knee joint. The contraindications for knee arthroscopy are actually an injury which happened immediately. So for example, a person has a fall or he had a twisting injury today. So for any surgeon, knee arthroscopy should be better done around 2 to 3 days after the injury. The best time is after 1 week or between the 1 and 2 weeks, because the tissues and muscles around the knee joint are highly contused and inflamed after the injury. So better to wait for at least 1 week or between 1 and 2 weeks will be the best time for the surgery. The other contraindications of the knee arthroscopy are infection. So if I suspect the knee joint is filled with pus or if it is infected, definitely not a real case for knee arthroscopy. I am not supposed to do knee arthroscopy when there is an inflamed or infectious knee joint. Of course not. The knee arthroscopy is part of the fixing of your knee. Definitely after the surgery, the post-operative physiotherapy, muscle training in the knee joint is very important for fixing the problem completely. Definitely the ligament stability which we give inside the theater in the knee arthroscopy is partial. For complete fixation, it will take at least 1 to 3 months. So this 1 to 3 months period, the patient should be protective, movement should be there under the guidance of the physiotherapist with proper muscle training. Yes, knee arthroscopy could be used for treating a tear in the meniscus, but equally each and every tear in the meniscus should not be treated by knee arthroscopy. I will go for a knee MRI, see the pattern of the tear, location of the tear. If the location of the tear and pattern is very severe, then we go for knee arthroscopy. There are few patterns and tears in the meniscus which could be treated without surgery. In those patients, we usually ask for physiotherapy and rest so that the meniscus may heal by itself by nature. There are few patterns which will exaggerate or the tear may increase over a period of time. Those tears, we take them to theater, we do knee arthroscopy and repair the meniscus immediately. Knee arthroscopy is a best surgery for treating ACL and PCL injuries. These are the common injuries which happen after any twisting injury of the knee joint, including a fall from bike, slip and fall at home, or any sports injury like while playing football, volleyball or badminton. So definitely ACL and PCL injuries, knee arthroscopy is the best. It could be treated successfully with less damage to the knee joint by doing a keyhole surgery or knee arthroscopy. Definitely general surgeon may not be able to perform a knee arthroscopy. There are people who are trained in keyhole surgery of shoulder, knee, elbow and wrist, etc. So the person who is trained in the knee arthroscopy or shoulder arthroscopy should be performing the knee arthroscopy surgery so that the time of the surgery will be less and there will be less damage to the cartilage around the knee joint, which is usual problem with a newcomer who does a knee arthroscopy. Thank you. I hope I have cleared most of the doubts and confusions regarding knee arthroscopy or keyhole surgery in the knee joint. If you have any further queries or if you need any surgical procedure in the knee arthroscopy, meet me in Pace Hospital, Hitech City. Thank you.